So there are different types of reflexes. First, we will talk about the rooting reflex. So rooting reflex is like it helps a newborn to turn their heads towards the touch on their cheek. If this reflex persists and not integrated properly, it can interfere with feeding and oral motor skills like lip movement, tongue control, or jaw coordination, which results in speech delay or any kind of difficulty in speech production. Next, we will talk about Moro reflex, which is also named as startle reflex. It causes a baby to extend their arms and legs when they feel that they are falling. If this reflex persists, it can interfere with sleep patterns, feeling of anxiety, disturbances in sleep, and other sensory processing issues. Next, we will talk about palmar grasp reflex. This reflex causes a baby's palm to close when they feel touched. If this reflex persists, it can interfere with fine motor skills as well as eye-hand coordination. Next is TLR reflex. It is when a baby is lying on their back, they have a tendency to extend their limbs. Again, when they are lying on their stomach, they have a tendency to flex their limbs. If this reflex persists, it can interfere with balance, visual tracking, and paying attention. Next is HTNR, and if this reflex persists, it can interfere with maintaining a good posture, good sitting posture or standing posture, attention as well as reading skills. Next is ATNR. It is when a baby turns their head towards one side, the arm and legs of that side tend to be extended and the opposite side arm and leg tend to be flexed. If this reflex persists, it can affect or it can interfere with the writing as well as feeding. Feeding means when the child starts feeding with hand, like they have to mix the food and then they have to take the food towards their mouth. So this direction, they will not able to find the proper direction. So this direction, this coordination will be affected. Next, we will talk about spinal gallant reflex. It is when a baby's back is stroked along one side, they have a tendency to curve their spine towards that side. If this reflex persists, it can interfere with the sensory processing and create sensory overload. So if we can identify the reflexes that are not integrated properly and start working on the reflexes, there is a high chance that over a certain period of time we can see a drastic change in the signs of autism.